Welcome back to Ladies Lounge. We still have our dear doctor here, Dr. Adeola, a consultant, gynecologist of the University College London. Welcome back. We are still on the topic of cervical screening. Can you explain for a lady who hasn't had a test before and she's going for the cervical screening test, what would she expect? What are the timings and...
So generally speaking, when you come for a test, you will meet either a nurse or a doctor who will explain what the test involves to you. I think it's quite helpful to look at the equipment because people talk about the equipment being difficult or painful. It isn't. So all that we have here is a small instrument which is called a speculum, and the speculum goes into the vagina to part the lips of the vagina so that the cervix, which sits on top of the vagina, becomes visible. And then with this very soft brush, the cells that are shed from the cervix are collected. So you're not scraping or removing anything. It's cells that are naturally shed. They're collected by this brush and then suspended in a liquid. The actual test itself, the taking of the smear, probably takes a couple of minutes. But setting up, explaining, and everything else probably takes about 10 minutes.
I have a question.
It's not scary.
It doesn't sound. You've just said it like in few words.
Yeah.
Would they usually put like a gel on the tip of that? Because I'm going to ask a very practical question. Sometimes we are dry down there and it's, so would they usually, is there something applied?
Very good question. And I omitted to say this is very well lubricated.
Okay.
It would never be put in without lots of lubricants.
Oh, yeah, exactly. It'll just slide in.
Indeed.
Okay.
Indeed, yeah.
Right.
I think I have a very strange question. What about for girls who are virgins? And they haven't had sex before? And how do they still have the test?
Generally speaking, if you have never had sex and you don't want to test, you're not obliged to have a test. If you've never had sex and you want to test, you can ask for a test. There is a thing called a virgin speculum, which is very, very small.
Obviously,
most people can tolerate.
Oh, that's very good.
So, Doctor, how often are women meant to go for this screening?
Screening starts from the age of 25 and it's every 3 years if your screening is normal. And if you've attended regularly and your screening has been normal, when you get to the age of 50, it becomes every 5 years. And following that pattern, if you attend regularly and you've had negative screening all the while, you get discharged at the age of 64 from routine screening.
That just something just occurred to me. Do you think, because I know very well that when you've done the test, you are sent a letter and then you're invited back to see your GP. Maybe that period of getting the letter and going to know the result is a scary time or of the unknown for a lot of women. What can be done? Do you think it's like a breaking of the news? And what do you think is the emotions that go through?
Break, isn't it?
I think the emotions that the women are dealing with at that period in time, how can it be handled? I'm not sure.
I fully understand that waiting can be a little bit anxiety-provoking, but really the majority of women will have negative smears, in other words, normal screening. And if your screening is normal, whatever the abnormality is treatable, which is why it's so important to go for screening.
It's quite reassuring, right? So it's not like this.
So the abnormality is not going to be cancer. The result might say that you have some abnormalities on the cervix which need more investigation. And you're likely then to be referred to hospital. A smear is a screening test. It's not a diagnostic test. If the smear is abnormal, you get referred to hospital for a more detailed test to find out whether indeed there is a problem, and if there's a problem, fully treatable. And 19 out of 20 women only need one treatment. The treatment doesn't affect fertility, doesn't affect your ability to bear children. Essentially, it just takes away the area of abnormal cells.
And I think hearing this it takes away the myth, or for me personally, it takes away the fear of having it. Because even if there's something, even if the cells are not normal, it's easily treatable.
Indeed.
And the earlier we do it, and the more often you do it, you have better chances of surviving.
Absolutely. Just a quick question, I'm not sure if I'm digressing, but now a situation where you have it 3 to 5 years and you don't get a letter from your GP saying come for your smear test, do you alert your GP? Do you just on your own discretion just go and just say, hey GP, I need to come see you?
Absolutely. So you're saying if you don't get your reminder letter?
That's right.
No, absolutely. I think we do need to take some responsibility for our own health health. And if you think 3 years have gone by and you haven't got the letter, could have got left in the post, ring up the GP surgery.
Yeah, I'm just thinking I haven't gotten it.
I haven't gotten it, and I know why I changed addresses.
That's so important. Phone up, because the letter's gone somewhere else, and make your appointment.
Okay.
And even if you're listening to this program and you got a letter 6 months ago and you ignored it and buried it with your bills, it's not too late. Phone up, say, I got a screening letter 6 months ago, I'd like to make an appointment. You'll still be accommodated.
Okay.
Fantastic. I think going back to talking about the tests when you go, is there any tips you can give to women to make them more comfortable, to make it a more, easier experience for them?
Bearable
experience, that's the word I was looking for. Thank you.
So I think it's important, particularly if you're nervous or anxious about the test, to tell the smear taker that you are nervous or anxious.
Okay.
Then come appropriately clothed. You know that you're going to have to be bare from waist down. So if you wear a loose skirt, if you wear clothing that you can get out of more easily, then again that just helps you to be more relaxed. There is a very small group of women who find this test very difficult and they're very tense. And I think it's important to discuss that before you start the test, because what we don't want is for the test to be so unpleasant that it puts you off going without the test.
Yeah, there's the group of women who find it difficult. I think, now I'm adding to what you've said, I think mindset plays a big role. If you know why you are going for the test, and if you know what can be prevented because of a test, and you know it's only for a few minutes, you can psych yourself up even before you get there, and it'll help you be a bit more relaxed. Because when they're tense, it's because they're not relaxed. So I think you need to relax. It's not that bad, really. Personally, it's not that bad.
I think for me, I've had it a few times. I think the first time I was like, oh my God.
The first time, obviously.
It wasn't a pleasant experience, but I think the next time I started to breathe.
Yeah.
When you're trying to just breathe and just relax yourself, and you think it'd be easier that way. Yeah. But if you're tense, then it's your whole body's tense.
Exactly.
It gets more difficult.
I'm sure
just relax, just breathe. It's not as bad as it seems.
Probably a lot of women who are listening and they're like, right. Doctor, I was just thinking that is this test free? Because a lot of people are going to be wondering, do they have to pay for it? Or is it completely free?
The test is completely free. If you are registered with a GP, you're eligible, you get your letter, there's no charge.
Now, there are people who haven't gone and later on find out, that they've got cancer, and, obviously it goes downhill from there. What would you say? Has there been any testament of somebody who did not go and later on had cancer?
Yeah, it's extremely difficult, especially you alluded earlier to Jade Goody, who sadly died of cervical cancer having ignored a test. And there was a lot of publicity around that. And a lot of people who'd ignored their screening letter went. And at that time, quite a few women were diagnosed with cancer when they attended for screening. And that's incredibly difficult, because a lot of women said to me, I really blame myself. I should have gone. We are where we are. Self-blame doesn't help. Often, if the cervical cancer is still treatable. The treatment is much more difficult than prevention, obviously. Prevention always being better than cure, but it's treatable. And I think it's always difficult when somebody has a potentially preventable disease, but
it's quite sad. Yeah, it's quite sad, because Jade Goody was only 27 when she died.
She was. Okay.
That's young.
Yeah.
Well, cervical cancer is the commonest cancer in women under the age of 35.
Okay.
So, and that's why screening is so important.
So we can't put it off at all.
Go and have your test done, or your screening done.
So now, just moving on to the next question, where can the women out there, you and I, go and find more information about this campaign? We need to know.
There's a lot of good information on the NHS website. So if you search NHS screening, NHS cervical screening, it'll take you to the website. I can never remember the full algorithm.
Yeah, but it'll be on the screen.
I'm sure I'll put it on the screen.
But now let's quickly talk about those people who don't want to log in, don't want to research, don't want to find information online or through the social media. There are a lot of women out there who they feel they don't have the time to log on, they cannot do that. How would they get that information? I'm concerned about those sort of women.
Well, as long as if everybody gets a letter, make your appointment. the person who takes your screening can explain to you the reasons behind the screening and the reason why it's a good idea to attend for your screening.
So what happens if the letter, I don't know, I'm sure it's automated and everything, but have there been cases where someone wasn't sent a letter and it wasn't their fault?
So it's a very tightly controlled system with a lot of quality assurance. So if a woman does not respond to her letter, she gets a reminder. And several reminder letters go out, and the GP surgery will contact the woman. And, this is all followed through with documentation. So it would be very unlikely, you'd be very unlucky that your letter doesn't eventually find you.
Because I know when I went to my GP once, the nurse asked me, have you had your screening? When did you have it last? Because I moved GPs. Maybe my information wasn't transferred. So if you go to your GP, they'll always it will flag up on their system, even if you haven't received a letter. So just,
So you can't run away from it, really. You can't say you didn't hear, or you can't say you're not aware. You're not aware. You are aware. We're telling you today.
Yeah, and ignorance is not an excuse.
Yeah.
So the reason why we brought this whole topic to you for 2 weeks running is to just get you enlightened, get you prepared, get you knowledgeable to go for your screening test. If you don't get a letter from your GP, you have to take responsibility for your health as a woman and do it yourself. So ring up your GP, your local GP. If you don't want to do that, talk to someone, but do not be ignorant of this because it's just not really worth it, is it, ladies? I don't think so. So thank you so much, Dr. Adeola. Olaitan, it's been a pleasure having you with us today, and I still like your hair. And thank you so much. It's really been lovely having you with us again, and we'll be seeing you soon. All right, take care. Bye. Bye-bye.
Bye-bye.